We spend twice as much as other industrialized nations on healthcare, yet our outcomes are poorer in comparison. Even after enacting ACA, 50 million Americans go without health coverage and millions more are inadequately insured. ACA has mandated that insurance companies reduce their administration costs from 31% to 20%. This means for every dollar given to a private insurance company, 20 cents goes toward pushing paperwork, while Medicare administration is only at 3%. Streamlining payments through a single nonprofit payer would save more than $400 billion per year, enough to provide comprehensive, high-quality coverage for all Americans. Do you think a single-payer program makes sense? And if so, how would you expand the Medicare program? How would we phase out insurance companies?
Pretty straightforwardly. We put this whole system under a national system like we do the Defense Department. We train those physicians and medical personnel in our best medical schools, and we have the highest trained and well-established medical system in the country. That's what it should be, and indeed in the world, excuse me. That's what we should be striving for. We're nowhere near that now, but that's going to mean you have to get the profit system out. This is a system right now. Corporations only have one motive in life, and that's to make money. When you make them medical corporations, they make money off the suffering of people. You should never provide that kind of a financial incentive system, especially when it's bankrupting the United States. All of the things being equal, Medicare alone is bankrupting our country. So we cannot afford to continue with this. We should get rid of those insurance companies. And we should also make a database available on every doctor and physician so that when you go into a hospital and you talk to someone about an operation, you can go to a national database and find out the track record of this person. Because right now, almost no one knows who this person is that they're doing this procedure with, and it's almost impossible to find out because records are not kept. More people are dying in our hospitals right now from these infectious bacteria that are running amok, like MRSA. They're talking about it's infecting 1 million people a year. And this is an epidemic. In fact, right now, if you're sick, the last place you want to go into is a hospital where these bacteria reside, and they haven't got really much of a clue of how to stop this problem.
Okay.
That's how serious it really is.
JL, talking about the switching to a single-payer system.
Yeah, that's bad. Sorry, Santa. Single payer is bad. It's evil. We can't have
I'm with you,
free
Santa.
health care anymore than we could have free automobile repair. Hey, look, free health care works in other countries because it's communist. Why don't we just have, this auto mechanic system where if your car is running bad, you drive up, they fix it, you drive away, and, everything's hunky-dory. You can't do that with automobile repair any more than you can do that with medical care. It doesn't work. The competition is what drives one doctor to be better than another doctor. I mean, up here where I'm living, and Harry, you're actually nearby, we've got a couple of kooks up here for a cardiologist and for a pulmonologist. I don't want to mention their names, but they need to be out of business. It's because they spend too much time in school learning about garbage instead of learning about, healthcare related issues. They're learning about how to write a thesis on, walking your dog, or on women and religion. No offense on women and religion, but that's not a class. That's totally irrelevant to medical care.
But you want them on commission, John.
Put them on commission. Well, they are on commission.
You want all the doctors and hospitals working on commission.
They run their private business.
That's operating on commission.
Yeah.
Is that what you like that system?
Yeah. Well, it's a private business. We have to get the cost of the machinery and the equipment out of the equation, and the price will drop more than that $40 billion a year, more than the $400 billion a year.
Well, do you not object to the 20% going toward administrative costs when you know that it can be handled for 3%?
Oh, of course it should be handled for a lot less. We don't need the that would come into the corruption with the lobbyist thing, because the CEOs don't need to be making $10 million a year on profits from the hospital. And yes, Harry, that is part of what you were talking about, and I do agree on that. But the doctor himself deserves to be paid for what he does. The administrator of the
Absolutely.
hospital does not need to make a huge salary for doing nothing. We got these paper pushers that are making, hundreds of thousands of dollars a year, and they don't do anything except shine seats and sign signatures. I've been running across them. My wife just went through a very serious cancer issue. And
I can make a quick point, though.
Well,
I think we would all agree preventative medicine is what we want to really emphasize, except there's no financial incentive in our existing system to practice preventative medicine. We like to treat disease because that's what makes money.
Okay.
But preventative medicine eliminates that. So
that's a good point.
With what we really need.
Santa, what about you? What do you think of this single-payer system, and would it cost a lot less to provide more care for everyone?
Well, I agree with Harry, and I'm in favor of the single-payer system. And part of the single-payer system has to do with an element of accountability and responsibility on behalf of the patient. Patients, I think, have a better idea of what they're spending for what and how they got to that particular medical situation in the first place. And I think it gives them more tools to work with directly, rather than waiting for some staff or an insurance company to say, oh no, we're going to possibly pay for that, but we're not going to pay for this other thing over here. And the patient has no clue necessarily how they could have improved their particular condition so that they wouldn't have had to go see the doctor or the hospital in the first place. So I would like to see the single payer system where people are getting what they pay for and paying for what they get.